We have some good news, we have some bad news. Gubernatorial preference, I'll start with the good news. The good news is we have a number of tests that have come back, coronavirus tests. The tests for the people in Buffalo came back negative. The test for the people in Oneida came back negative. We tested someone in Suffolk that came back negative. And the husband of the healthcare worker who traveled to Iran came back negative. I actually wagered the other way. So that's the good news. The not so good news is the case in Westchester, which was a 50-year-old attorney who was tested positive. His wife has also tested positive. His 20-year-old son has also tested positive. His daughter has tested positive, and his neighbor who drove him to the hospital also tested positive. The son is 20 years old and attends Yeshiva University. The daughter is 14 years old and is in the SAR school. And the neighbor is not just a neighbor, but actually drove the attorney to the hospital and therefore was in a car with the attorney in that closed environment, and the neighbors tested positive. That then triggers the detective work where we go back and we try to make as many connections as possible and do as much research and investigation as possible. And then notify people, right? Whenever you find a case, it's about containment and doing the best you can to keep the circle as tight as possible. The head of Yeshiva University I spoke to this morning, and the school that the son attends will be closed for today. The SAR school is also closed for today. We are going to meet in Westchester this afternoon at noon with the heads of the schools and the county and the local health officials to get some more facts and start to track back to the best we can. I also want to announce that we're going to recall SUNY and CUNY students from study abroad programs in 5 countries: China, Italy, Japan, Iran, South Korea. Those are countries that have been on the quote-unquote watch list, recall list that the federal government has set. The students will come back on a chartered plane, which will land in Stewart Airport. They will then be quarantined for 14 days in dormitory settings. We'll then stay in touch with them after the 14 days to do follow-up work. On all of this, the context is what is most important. And we have an epidemic caused by coronavirus, but we have a pandemic that is caused by fear. Now, what causes fear? Only 2 things. People get afraid when either they think they don't have the right information, or they don't trust the information they're getting, or the information they're getting is so frightening that they have the normal reaction. I think in this case, people are suspect about what they're hearing because government now is so polarized in so many ways. The environment is so political that you hear different messages about this situation. And then it gets politicized. The Democrats say the Republicans are trying to minimize it. Republicans say the Democrats are hyping it. So I think it's very important here in New York that I provide the factual information to people so they know these are just the facts. The second point is, once you accept the facts, there is no reason to be frightened by these facts. remember the context. You have to take a step back. There are going to be many, many people who test positive. By definition, the more you test, the more people you will find who test positive. If you went out and started conducting tests for the flu virus, you would find more people who have the flu virus, who are walking around and didn't know that they had it. Then you start testing, you're going to see the number go up. We know what this coronavirus is. We've gone through it in China. They're going through it in other countries. We know what it is. It is easily transmitted, but 80% of the people who get the virus will self-resolve. The other 20% may be medically ill and even require hospitalization, in which case we have that capacity. And the lethality rate, according to CDC, is 1.4%. 1.4% compared to 0.6% for the normal flu. And again, these are just estimates. Sometimes the 0.6 is a little higher, a little lower. Sometimes the 1.4 is a little higher, a little lower, 1.2. But it's roughly double the flu rate. And the people who we are most concerned about, who are most vulnerable, are senior citizens, people with immune compromised situations. Those are the people who are most vulnerable. What we're worried about, nursing home setting, senior care setting. That's what we've seen in other places, and that's where the situation is most problematic. And if you look at what's even happening here in New York, it confirms that. The 39-year-old healthcare worker who came back from Iran, who tested positive, she is at home, has not been hospitalized, and she's getting better. Her husband, who didn't turn out testing positive, he is getting better. The 50-year-old attorney in Westchester, he had an underlying respiratory illness. So he is in the category of people who we worry about in this situation. But those are the facts. And if you understand the facts, there is no reason for undue anxiety. We're now in this loop where, well, we're testing one person, two persons, three. There are going to be dozens and dozens and dozens of people. And the more people you test, the more people you're going to find. So that is the situation, and let's just keep that in mind. And when you ask the CDC, well, what's the variable on how many people this virus is truly dangerous for, they say it depends on how well the healthcare system operates. China was close to 2%, but China did not have an existing state-of-the-art healthcare system compared to the United States. When China started to do better, it dropped from 2% down closer to 1%. So the level of healthcare and the quality of healthcare is very important. Luckily, here in New York, we have one of the best healthcare systems on the globe, period. And we are doing everything humanly possible to improve even on that.